Don't shoot the messenger.
Okay. Yes, thank you, Mark, and good morning, everybody. And for those of you that don't know me, my name's Catherine Berzins. I'm a Senior Research Fellow in the Impact team. And with my colleague, Alison McLaughlin here, we support the Mental Health Roundtable. And we're just going to provide an update about the work of the Mental Health Roundtable. We're going to look at three things that the Roundtable does. The first is this capacity building work that it does. The second is the just some information about a research interest audit that we carried out. And the third is looking at some of the research priorities of some of our member organisations. But first of all, I'm just going to give an overview of the Roundtable itself. So as Mark mentioned before, we had extra funding to develop capacity in mental health research. And one of the ways that we're kind of providing oversight for that funding was to set up a mental health roundtable. And basically the purpose of this is to bring together a range of stakeholders with interest in mental health. So across academic institutions, health and social care, third sector, community and voluntary organisations, and along with a public advisor representation as well. And that roundtable provides a forum for people to come together and I suppose shape the research that we support and develop through the other part of the work, which is the internships and early career fellowships. The roundtable has a long list of objectives that I'm not going to read, but they can basically be summarised as identifying research priorities and supporting work that addresses those research priorities, and along the way providing increased research skills in our health and social care workforce. So what I'm going to do is hand over to Alison, who's going to talk a bit more about our internships and fellowships and what we've achieved over the past 12 months. Okay, Alison. All right, yeah, it's down there. Oh, okay, if you can see it.
I can see it just about. Hi, pleased to meet you. So I'm Alison McLaughlin, fairly new to the ARC. For those of you that I've not met, it's nice to meet you, and for those that I have met, it's nice to see you in person. So I've started in the ARC and I'm looking at capacity building, working with Colette Miller. And as you know, we do support the interns and other fellowship opportunities, but today I'm just going to introduce you specifically to the mental health capacity building that we've been doing, as Catherine said, as part of the additional funding that we've received. We've got money to be able to support additional resource within capacity building. So for those of you that don't know, and I'm sure everybody does, but I always keep catching somebody that doesn't, we offer internship opportunities that release individuals from member organisations to undertake research activity 1 day a week for a year. And it allows them to do various opportunities in terms of internships. We offer research internships where they undertake a small research project supervised by academic researchers. We do the rapid access conversion of evidence summaries, ably supported by the MIDAS team, which allows them to look at existing evidence that's already there, develop the critical appraisal skills, publish clinically or practice relevant paper off the back, and also develop ideas about how that evidence should be implemented into their own organisations. And we also support fellowship applications. So whether they're pre-doctoral, doctoral or advanced fellowships with the NIHR, other funding bodies, or the DSE awards that the NIHR offer. And to be eligible for these, as I've said, you've got to be an individual employed by one of our member organisations or a public advisor. So under the additional mental health funding, we've actually recruited 3 interns this year. And we have videos of 2 of those to tell you about the work that they're doing.
Hi, my name is Georgie Burnwatt and I'm the Quality Improvement Partner and Research Lead at the Life Rooms. The Life Rooms is an NHS organisation that works to address the social determinants of health through a three-pillar approach. So we work with communities to activate them in health and wellbeing and to address practical concerns around issues such as housing, education, finance and social connection, all of which can have a significant impact on somebody's health and wellbeing. My role specifically involves research and evaluation of the interventions that we've designed and implemented. So I was particularly interested in completing an internship with ARC because the activity that takes place within the Life Rooms is contributing to local and national agendas as well as population health objectives, something which I found throughout my application with ARC that they are doing too. Having the opportunity to work with researchers at ARC has provided me with the guidance and expertise to develop my own knowledge and research skills and be able to bring something that I'm really passionate about to the forefront of my research. My work streams at the Life Rooms and my beliefs about the Life Rooms and the social model of health are aligned to the aims and the objectives of ARC. So I'm particularly interested in ARC's aims to support and evaluate implementation of research findings that address health priorities to increase sustainability and resilience of health and social care systems. And I also strongly advocate for the need to shorten delays between research needs that are identified and then studied and findings implemented, because we know from the work that we do in the Life Rooms that it's these delays, particularly in the field of health, that are detrimental to both individual and population health and can ultimately cost lives. So that was something I was really interested in researching more about. My project specifically is focused on a piece of work that we've completed in the Life Rooms. So in late 2021, the Life Rooms was commissioned by Public Health Liverpool to launch a mental health initiative to support individuals and communities with their health and wellbeing post-COVID-19 pandemic. So we had a 12-month pilot which enabled the Life Rooms to have a presence in local libraries, one-stop shops and children's centres across the city. The aim was to provide communities with practical support and learning opportunities to help their health and wellbeing, and also support them with practical issues around family and caring responsibilities, mental health, physical wellbeing, financial difficulties and housing issues. As part of that project, we looked specifically at an early years pilot, which was set up to improve low-level mental wellbeing in families, children and caregivers. So this includes looking at themes such as anxiety, safety, loneliness, worry, fatigue, stress and depleted resilience. So the Life Rooms pilot is about working in these early years settings such as children's centres to reduce known modifiable population drivers and mitigate the risks for families who are vulnerable to their children becoming either looked after because of issues such as substance misuse, domestic abuse, financial insecurities, housing insecurities, or whether they're from a family where there's parental mental health and loneliness. We wanted to be able to demonstrate that we can impact the life of a child by supporting families with their health and wellbeing. The research project which I am undertaking will consider the following. So how and why does Liverpool lend itself to a social model of health? Why is it that places like the Life Rooms are well placed within Liverpool? What would a social model of health look like in an early years setting? So working within children's centres, how would we change the practice that we've had previously, or what amendments would we make to our services to make it accessible and suitable for an early years setting? Why parents and caregivers are particularly in need of this service and why that's the case in Liverpool particularly. I wanted to have a look at the impact on kinship carers, and we also wanted to be able to have a look at adverse childhood experiences, so ACEs, what they are and how are we trying to reduce them throughout Liverpool through the work that we're doing with children's centres. My project will consider the implementation of an early years service within the Life Rooms social model of health. So how is the introduction of a social model of health support within children's centres being implemented? I'll consider some theoretical framework, and this project will consider normalisation process theory and consider how the implementation of the Life Rooms and the social model of health has been implemented in a new setting within the children's centres. This will allow me to identify factors that support successful implementation that should be considered in the future, as well as highlight any barriers to successful implementation for future learning. I aim to interview staff from both the Life Rooms and staff from children's centres to have a wide range of perspectives, and these interviews will ascertain things such as a professional's experience of implementing the Life Room services, why and how were new posts designed and implemented, what was the relationship between groups of staff, how did the collaboration increase capacity within roles and work streams, was there clarity in roles, what was the impact of this, or maybe there may not have been clarity, were there tensions between new services and new roles, and what were the challenges to implementation that were faced by the services.
Okay, so that's one. As I say, we've recruited 3. So there's another one that's around service evaluation, testing the feasibility and acceptability of a co-designed group, psychoeducation group for people with a diagnosis of bipolar disorder, which we haven't got more information on, I'm afraid. But then this one is a fellowship internship. So I'll let Isabel speak for herself.
I'm Isabel and I'm a speech and language therapist. I've created this short video because I'm about to start an ARC-funded internship that's related to the mental health and well-being of autistic people. I've been asked to give a brief overview of the project I'm going to be planning over the next 12 months. The Thinking Patterns in Autism profiling model provides a really simple way of talking about autism. It focuses on skills and strengths and helps us to develop support plans that consider some of the less visible aspects of autism. In recent years, the evidence on inequalities faced by autistic people has been mounting. Autistic people are often more vulnerable due to experiences of bullying, exploitation, and exclusion. Also, sometimes choosing to withdraw due to feeling misunderstood. In some cases, the personal and economic cost can be huge. Over the last 25 years, I've worked with adults as well as children and their families. I think one of the most striking things about autism is the difference that understanding can make. Currently working in autism diagnostic assessment services, we believe that when we help young people to understand themselves and to be better understood by others, we can contribute to healthier long-term mental health and well-being. In contrast, when a child is misunderstood and when they become disheartened about who they are, the detrimental impact on mental health and well-being in later years can be very severe. As an example, I want to tell you about this man. Let's call him Tom. I met Tom about 6 months after he'd attempted to end his own life. He's an intelligent and articulate man. He would like to work and has potential to make a significant contribution to the world. However, he ended up sleeping in his car because he couldn't tolerate his housing association flat due to sensory overload. And he'd lost 3 jobs and been banned from his GP practice due to emotional overload. His distress was perceived by others as aggression, and he was asked to leave. Tom believes that his life might have been very different if his needs had been identified in childhood. As part of my current work with children, our aim is always to help people to understand more about the way they process and interpret things and why they respond the way they do in certain situations. When we have a better understanding of a person's unique skills and thinking patterns, we can be clear about what skill building, support and adjustments are needed. The Thinking Patterns in Autism profiling model was first developed when I was working in schools. I'd wanted to create something to help young people to understand their own unique form of autism by focusing on their skills and thinking patterns rather than their impairments. The Thinking Patterns in Autism profiling model offers a standardized system to give meaningful outcomes in less time, creating an easy to understand visual profile alongside the written report. In the last few years, I've completed a few small projects, written some papers, published 2, and recently submitted a 3rd. This ARC internship is going to be used to develop a fellowship application so I can test the internal and real-world validity of the tool. Over the next 12 months, I'll be working with autistic people, their families and other stakeholders, such as those who deliver, buy, manage and research autism services. Together, we plan to co-design the project. You can see from this slide some of the deliverable benefits linked to the wider project. Above all, the model will help to provide a common language that can be used across organisations and services. It offers a way for each person to talk with others about their profile and what it means for them in everyday settings. In terms of outcomes, this project could also contribute to wider work on reducing health and other inequalities at 3 levels. Firstly, inequalities affecting autistic people compared to non-autistic people in real-world settings. Secondly, inequalities affecting people with less visible forms of autism, such as girls who've previously been missed or misdiagnosed in assessment services. And thirdly, inequalities affecting those who are able and informed enough to access the service compared to those who are not, due to ethnicity, for example. This project will be designed to benefit autistic people and their families, enabling more equal access and participation across settings. So that's the end of my presentation. Thank you for listening.
So as you can see, there's some amazing work going on already with the funding within the internship programme. And the other exciting development is that we're now supporting mental health early career researcher development fellowships. I did practice that. And these again are to support early career researchers to develop substantial grant funding applications, and it allows them to do the groundwork or whatever they need really to be able to develop those robust applications going forward. So we've had one call to date and we've awarded one so far. And to be eligible, the individuals must have previous research experience, but ready to become a chief investigator. So we are developing the workforce of the future. Okay, so as I said, we've had one call to date with one application, which was around using cricket to address ethnic mental health inequalities among migrants and asylum seekers. We had another call out and the deadline was actually 5 o'clock yesterday. There were 9 application packs out. And when I checked yesterday morning, we'd had 2 applications back, but I might be able to update on the final number before the end of the day. So it's just to make you aware, the internship timeline has been planned to the end of what we thought was the ARC. So we need to do some work to get us for the extension. But there are calls out, all the information's on the website. If anyone wants any more information, then contact us in the capacity building team. But these are fabulous opportunities. And obviously we focused on the mental health specific work today, but there is a range of opportunities available across a massive breadth and scope of health and social care. Thank you.
Thanks, Alison. Yeah, the other information that we wanted to share today is an exercise that we carried out earlier in the year as part of the mental health roundtable, where we were interested in trying to collect data around what kind of mental health research interests there were across the members of the ARC who are researchers, and also what the member organisations saw as research priorities with regard to mental health. So I want to just share some of those findings because they were quite interesting and might stimulate further responses from people that are here today. So we had 2 separate audits, we called them. The first one was aimed at mental health researchers, and we had 93 people respond to that, which was a really good response, and a lot of information was provided within those responses as well. And that was mostly from the higher education institutions that are members of the ARC. It was because the responses were very diverse, we ended up categorising them into sort of 5 different categories, and I'm just going to sort of show those briefly. So the question that we asked people was, what are you interested in researching in future? So we asked people what kind of experiences they had in mental health research already, but we thought it was more interesting, what that had led them to be interested in future. So in terms of population groups, you can see that there was a lot of interest in research in children and young people's mental health. So that that kind of chimes with some policy priorities at the moment. So I think that's a good sign. There was also quite a lot of interest in health and social care staff, mental health and well-being, which I think, again, in the light of recent years and people's experiences, is also very relevant. And I think there was quite a lot of interest in student mental health. I think that represents the the population that people work with. So we weren't surprised to see that. Moving on, there was interest in specific conditions. So there was a lot of interest in developing research into trauma, and there was also a lot of interest from the academic staff in research around personality disorder diagnoses. And it was interesting to see that COVID, the kind of after effects of COVID, were quite prominent in there as well. Come on, move. Right, there we go. There was also interest in specific interventions, so testing the effectiveness of a variety of interventions, and lots of interest in digital innovation. So, which is not really surprising, but there was a lot of interest in that kind of research, and also a lot of interest in non-pharmacological interventions, so various types of creative therapies and different types of talking therapies, that kind of thing. In terms of service settings, there was people were interested in perinatal mental health services and school-based mental health services, obviously with that that high interest in children and young people's mental health. And then finally, there was some very broad issues that we've just classed as social determinants. So people interested in what people do for a living, working hours, that kind of thing, broader policy, and also interest in the impacts of social media. So that was what our mental health researchers were interested in. We put a separate consultation out to our member organisations, and first off, we didn't get a brilliant response to that. So we used the Corin network, which has like a kind of cascade through different regions in the Northwest Coast, to spread that a bit more widely, and we got a much better response from that. So ultimately we got responses from nearly 50 community organisations, 50 organisations altogether. Some of them were still higher education institutions, which kind of clouds it a little bit, but never mind, at least we got that representation from the voluntary sector. So in terms of what they saw, the priorities, there wasn't the same focus on children and young people's mental health as such, but there was a lot of interest in parenting and supporting parents, either supporting parents with children who are experiencing poor mental health, or supporting parents who themselves might have poor mental health. In terms of specific conditions, there was a lot of interest in the relationship between physical health and mental health, and whether that was about specific, like perhaps people living with long-term conditions, or around diet and exercise. There were lots of different things that came under that category, but that was a clear interest to a lot of organisations. And similarly to the academic researchers' interest, there was a lot of interest in non-pharmacological interventions. So again, there was a wide range of things in there, again, including kind of mindfulness, creative approaches, that kind of thing. And also interest in how we support carers, which wasn't something that particularly showed up in the researchers' interest, but it was very strong in the member organisations. And you can see that digital innovation is down there as well. So, and you know, this is not a surprising finding at all, that the priority for these organisations was they wanted to know how we can better increase access to mental health support, because that's something that people are really struggling with at the moment and over the past couple of years, and only seems to be getting worse. And again, some interest in, you know, these very much broader societal determinants of mental health. And I just want to kind of compare the two on this slide, because when we looked at the top 10 priorities for researchers on the right and member organisations on the left, actually sort of 6 out of that 10 overlapped, which, you know, I think is quite a good sign in terms of the relevance of what researchers are interested in compared to what the priorities of member organisations are. So hopefully there's the potential to kind of match up some of these groups and some of these people and some of these organisations in terms of developing, you know, collaborative approaches to address some of these issues. So I think that all in all, it was quite a positive finding that we weren't in completely different places, and there was, you know, there was a fair degree of overlap. So like I say, hopefully this is work that we will take forward over the next 12 months to, you know, to turn into research proposals that again will hopefully increase that capacity in mental health research. So that's everything I wanted to share from the roundtable.